for dentistry. That's what people said to me as well. And then I thought like, what is so difficult about learning just like your teeth? But that's not the case. I want everyone to know that's not the case. You know, you actually have to study quite a lot. So what the medical students learn in 5 years, you have to do it in 1 year. And it's like bullet train. Yeah. But for me, I feel like after years of working, you know, work-life balance for me and the fulfillment you get when you put a smile on a patient's face lah. You know, regardless whether it's relieving pain, you still bring a smile to their face, or whether it's aesthetic, you still put a smile on someone's face. So I think that is the fulfillment you get. You don't just go in and know your purpose. You actually have to grow in this industry.
Hi everyone, welcome to another episode of Excel Education Talks. We are aspired to inspire you through the series of conversations we're going to have with people from different industries and educational backgrounds. My name is Yuran. I am an educational consultant at Excel Education, which is a university placement agency. For more information about Excel Education, you can visit our website, Facebook, Instagram, LinkedIn page, or get in touch via email or WhatsApp. Joining Excel Education Talks today, we have Charlene Tan. She graduated with a degree in Doctor of Dental Surgery from Mahsa University and has been practicing as a dentist since 2016. She's going to share some insights with us about her journey of becoming a dentist and her experience practicing in the field in Malaysia. Thank you so much, Charlene, for being here today.
Hi, Iran. Thanks for having me.
Okay, first of all, I want to know, why did you want to study dentistry?
So the reason why I wanted to study dentistry is because it's a stable paying job. I believe in work-life balance. So I feel like dentistry can give me that. So what I do is like, I work for 9 hours and then I'm done. Like, I don't want to bring work home. So to me, that is the most important. A stable paying job as well as a work-life balance.
So unlike medical doctors, like, you know, they have on-call and they probably have to stay longer because of emergency situations. So that's not the case for dentists, right?
No, unless you work in hospital as an oral surgeon. So oral surgeon, you work in a hospital, and that one, if you have like any crash, you know, or any fracture of the mandible or your jaw, then you have to go in for on-call. That one is just like a specialty, so you have to choose it if you want to. So for me, it's like, no.
Yeah. Okay. All right, so we know that you graduated from Mahsa. So why did you pick Mahsa University?
Mahsa is one of the longest private uni that offers dentistry course in Malaysia. And then for the facilities, for example, the dental chairs, they have new ones. So most important is you don't have many people sharing one dental chair. And in Mahsa, one chair is catered to only 2 students. So it's vital. You know why? Because you need to finish all your requirements. So you don't want to be rushing with everyone for a dental chair. So to me, I think the dental chair is very, very important. I mean, it's very, very important, you know, to finish your requirements. And moving on to the lecturers are very experienced lecturer. So you may see their names on the dental courses offered outside the uni parameters. So they are quite popular and they are very experienced. So
prior to going to Mahsa, do you even know that, like, did you get information about the university?
There are a few universities available for private uni during that time that offers dentistry, and I think the primary reason why I chose Mahsa as well is because it's in Malaysia. So I do a full time of 5 years in Malaysia. I was actually offered to go to India, but knowing my character, I love to be like nearer to home. So that's why I chose Mahsa instead. Yeah.
Okay. So you mentioned about the dental chair, which is quite important, right? Because that's where you learn all your clinical skills, which prep you for becoming a dentist. But like, everyone is talking about dental chair, right? Even when I talk to university, they also emphasize on dental chair. I talk to different dentists, they also say dental chair is very important. But why is it so important? What is so special about dental chair?
it's the most important equipment in dentistry. Without the dental chair, you cannot be a dentist. So because the dental chair, and it's very expensive, by the way. A dental chair is very, very expensive. We're talking about 100,000 just for one chair.
Just for one chair?
Yeah, and to upkeep the chair is also very expensive. But the reason why it's so expensive is because you have everything there. You have the suction, you have what we call the sink, the small sink for you to spit, and then you get to recline the chairs for the patient as well as for the dentist back. And most important, the drilling, to drill and to do filling requires water. So everything functions together. Yeah.
Was it hard to get into the program?
It's actually quite easy. Most important is meeting the entry requirements and you're in. So my advice always for everyone who wants to do dentistry, who really wants to do dentistry is you have to score in your pre-university or your A-level course. So you may not do very well in your SPM, but if you score, if you really put in effort for your pre-university and you meet the entry requirement, nobody can say no to it.
Like it's a 5 years program, right? It's pretty long. Was it hard to study though?
To be honest, I will not sugarcoat it. It's hard. It's very hard. I always say to myself and my friends during that time, and my friends share the same sentiments as well, regardless how much you study for the exam, you can never be 100% prepared for the exam, for any papers, because there's just so much to study. You just have to go in faith and hope that the topics that you studied come out.
Any study tips though for students who are planning to go into the program or are ready into the program?
Be consistent. You cannot last minute. There's no such thing as last minute in dentistry or in medicine for that matter, because every single page is a fact. So you have to memorize it. So if you're thinking that you can, do like what you did in SPM, like last minute, no, there's no such thing. You will sure be like, you won't score. So it's really being consistent. Like means every day, you try to allocate time to study. Yeah.
All right. Okay. So what is the process or requirement of becoming a dentist in Malaysia?
So this is actually quite important. So after you graduate, you have to wait for your housemanship. So during my time, it was a 1-year housemanship. And then after that, automatically you become a permanent dentist in the government, unless you choose to quit yourself. Okay. But for now, 1 year of housemanship still stands for the new dentist, but the government offers an extension of 2 years to work. Then after that, they either retain you or they release you. So this new system is what we call the contract dentist, meaning 1 year of housemanship. So the government will give you an extra 2 years to work with them. And then after the 3 years, you have to apply and see whether you can be a permanent dentist in the government setting, or no choice, you have to go out. Yeah.
So the chances of actually remaining in a government hospital is actually quite difficult. Unless for contract worker it's easy, but as a permanent staff with the government hospital is actually quite difficult with the current situation.
To be a permanent in government is it's quite difficult. That's the reason why we hear in a lot of the news nowadays about the code black and things like that. So this is what people are asking for, to be retained in the government. Yeah.
So the 5 years program, right? So the first and second year would be very just about theory, right? And then the third and fourth year and the fifth year, what do you do?
In the third year, you have to learn medical subjects such as general medicine and general surgery. So during that time, you will have your posting. Like for me, it was a posting in HKL, Hospital Kuala Lumpur, 2 out of 5 days. So like usually it's like 2 out of 5 days, you have to be in the hospital in the afternoon. So if I have to summarize what you're doing for general medicine and surgery is, you are learning everything in medical like a bullet train. So in a span of 1 year. So to me, I honestly didn't like that year at all. I think that was my worst. It was my worst year. Yeah, because you practically have to learn everything. We're talking about seeing real life patients. Breast cancer, we have thyroids, we have hernia, we have everything.
Like a medical student.
Correct. So what the medical student learn in 5 years, you have to do it in 1 year. And it's like a bullet train. Yeah.
Did you expect that before going into the program?
Yeah. And
Wow.
I guess that's the reason why they call you a doctor. You must know lah. But there are some things that are very important, like hypertension, diabetes, asthma. It's directly related to dentistry as well. For dental subjects, so we start seeing real life patients from the second year onwards. So every day we treat patients in the afternoon. Okay, so we put like in the morning will have lectures, and then in the afternoon we'll be seeing patients.
And that would be inside Mahsa itself, or
yeah.
Oh,
so
okay.
One thing I like about Mahsa, like I said just now, is they have a dental clinic inside in the building itself, so you don't have to go anywhere. And I think one good thing as well is Mahsa has other clinics outside of their campus. So the reason why they have another clinic outside is so that other patients will walk in, like the outpatients will walk in. So they see the dental clinic, so they will walk in. In a way, you get more patients for you to finish your requirements. So we have requirements such as extraction, filling, everything. So we have to finish all these requirements. So if you don't get patients, you can't finish your requirement.
How many hours are we talking about this requirement that you need to fulfill?
It's not the hours, but like take for instance, during my time, you have to do like 30 extractions in order to graduate.
Like you say, you are not only learning about dentistry, anything that's related to dental, but you're also learning things that medical students learn. I think that's the tough part.
Yeah. Before I actually signed up for dentistry, that's what people said to me as well. And then I thought like, what is so difficult about learning just like your teeth? But that's not the case. I want everyone to know that's not the case. You actually have to study quite a lot. Yeah.
Wow. Okay. So after the 5 years program, that's when you go into your housemanship, right? And you mentioned that housemanship is 1 year. So what exactly is housemanship, and what do you do?
You must do your housemanship with the government in order to get your dental license to work in Malaysia. So this is what we call APC. It's our dental license. I think now to book your housemanship it's quite difficult. So how it works is that there is a portal that allows you to book your spot. They will let you know when is the next intake, when they are going to absorb new dentists. So there is a certain number that they will give. And then so you sit in front of the computer, you wait for them to open the portal. Then the moment you're in, you quickly scroll to the clinic that you have in mind. Okay? And faster book your spot. So my advice during that day is have really good internet. No such thing. If you have poor internet that day, say bye-bye to your clinic and go like real, the outskirt of Malaysia. Yeah, it's no joke.
Wow.
Yeah.
What's the average waiting time to get a spot?
So during my time, I had to wait for 6 months. So 6 months, but when I interviewed the new houseman, they said that they waited 1 year, like 6 months to 1 year lah. Yeah, 6 months.
What do you guys do while you're waiting? I mean, 6 months, I can consider it as a short break, right? But if it's 1 year, then what do you do? Like expecting, like, you expect that, after you spend so much time and money, it's very costly. We know that, to study dentistry. And then all of a sudden you're like, just wait. You just need to wait. There's nothing much you can do. Like, what do you do? Yeah.
I think during that waiting period is one of the worst feeling ever, because you feel like you study so hard, like for 5 years, and then you have to wait for so long, very uncertain of when you'll be absorbed. But I think what I did during that 6 months was I went to work in Singapore, and I worked entirely different. I didn't work as in medical related. I went into like law, but yeah. So I did law. I mean, like a secretary to a litigation lawyer during that time. But I did ask my other people like what they did, like especially the housemen now. They go to private dentists to work as dental assistants. I think it's a win-win situation because you get to see what the dentist is doing. Yeah, so you get to see real life, like how to manage patient, a real life setting. So you just be a dental assistant, So I think that's quite good. I think that's a very good idea.
Okay, and then after housemanship, what's next? So usually, I think for you, you say that you managed to stay in the government hospitals, right?
Yeah.
Yeah, and now it's like, so either they become a contract worker or they go into private practice. Is that correct?
Correct. So, dentistry, I don't think there's much, like career pathway. Okay, so for contract workers, if we're talking about now, the contract workers, so if they do not retain you in the government after the 3rd year, so you do not get absorbed. So the next option you have is just to go into private practice. Okay, so let me talk about like the career progression, for dentistry. So you either go to private practice, number 1, or number 2, you specialize. Just like medical, they have specialization course, we have as well. So in layman terms, the braces that people do, these dentists are called orthodontists. So we have for gums, perio, we have different specialization. But one thing about this specialization is that you have to do full-time. So
full-time as in full-time with the government or full-time? Okay.
You can do it privately or you can do it in the government. But of course, if you don't get absorbed, then you're all on your own, so you have to go private. So this 4 years is very expensive. We're talking about almost another $500,000 just to study full-time 4 years. So this is the reason why people want to retain with the government, because what the government does is that you can apply and they may sponsor your whole entire 4 years of specialization course, your specialist course.
Oh.
Yeah, so that's the reason why for contract workers, they don't get privileges like this. But I mean, if the government sponsor you, I think it's quite good, 4 years sponsored by the government, you still get your pay every month. But of course, after that, you'll be bonded with the government for another maybe 10 years. I'm not too sure exactly how many years, but yeah, you'll be bonded for some time.
Thank you for explaining that.
Yeah.
I think the next we want to talk about what are the challenges and rewards you get practicing as a dentist.
For the challenges is always it's physically tiring. In uni, you only see maybe 1 patient per day or 2 patients per day max. In government clinic, in the morning itself, you can see 20 patients in the morning itself. And I've seen 25 patients in the morning itself. So that's a lot. Like you have no time to do anything. So imagine this scenario, you just finish a difficult extraction, and you're very tired. It's physical work, you're very tired. But then once you finish, there's no time to rest. You have to write your cards, you have to put it into the system. 5 minutes after that, the next patient comes in. So that is like physically tiring. It's one of the challenges. So there's 2 vital reasons why patient comes to see a dentist. Number 1 is pain. Number 2 is aesthetic. Okay, why I say that? So the reward you get from dentistry is that if you are able to diagnose and rectify the pain, then your patient will be very relieved and happy. And let me tell you, dental pain can be very, very painful. It wakes you up at night. Yes, it wakes you up at night. So you see a patient face, right? They are like, oh my goodness, as though they went through an operation, one whole, like a surgery. So they come with this face that they're really in pain. So if you're able to rectify that pain, they are very grateful. And I think that itself is a fulfillment, and that itself is a reward when you look at them. And then number 2, aesthetic. You know, I'm not sure whether you've seen this picture. Have you, Yiran, about this guy? He doesn't have an eyebrow. So one 2 of his eyebrow or one of his eyebrow is like, you cannot see his eyebrow. And then and he has also 1 missing front teeth, like 2. Okay.
No, I haven't seen this. Yeah.
No? Okay, so that picture, when they asked, what is the first thing you see? So people immediately said, oh, he has a missing tooth. People did not realize that he doesn't have an eyebrow, like literally no eyebrow. But the first thing people realized is his missing tooth. So that is aesthetic in dentistry. It's very important. Yes, you know, the reward is it makes the patient looks better, but I think more so it boosts a person's confidence, and I think that is more important lah.
Okay, what are the tips and advice for students who want to go into dentistry?
Yeah, I'll just be very honest. Okay, like for advice, I would ask the students or whoever who wants to take dentistry, why do you want to study dentistry? So is it because you will earn good money? This is something that the old mindset has. You know, people think that, you know, even parents think, oh, you know, if my kids do dentistry, they're going to earn a lot of money. I'm just going to be honest, like I said, for now, it's very competitive. Okay, like, I mean, I think you can see it for yourself as well. You know, when you go out, you see many dental clinics, like private dental clinics, you know. You can still earn very good money. You know, I'll still put it out there. You can still earn, but you have to work very hard because you're competing with a lot of people, you know, and you have to be really good at what you do. But if you think that you're going to like work a 9-hour job and earn exponentially a lot, that's not the case. Yeah. And then also remember that you have to invest a big sum of money to study dentistry. You know how many years you have to work in order to be able to pay back that amount of money. So it's something you have to think, are you willing to sacrifice? And then I also remember my lecturer told me this, and I thought it was very profound. You know, I hope people will realize this as well. You know, you have to ask yourself, how passionate can one be looking at people smile every day? You know, I don't get up in the morning and go like, oh, I'm so excited to see someone's teeth, like someone's mouth every day. You know, so I think it's true. It's very true, you know. So, but for me, I feel like after years of working, you know, like I said, work-life balance for me and the fulfillment you get when you put a smile on a patient's face lah. You know, regardless whether it's relieving pain, you still bring a smile to their face, or whether it's aesthetic, you still put a smile on someone's face. So I think that is the fulfillment you get lah. Yeah. So you have to really think properly. Yeah.
A really honest questions that I think whoever wants to take up the program or, you know, pick this pathway really need to ask themselves, right? So yeah, really thank you for these great tips and advice that you have.
Correct, because I did ask a few housemen who just came into work. So I did ask them all these questions as well, and then a lot of them said that it's work-life balance. Then, you know, when I probe further, you know, it's always money as well. You know, it's like money and all this thing, and you know, to think that at such early working life, right? You know, some of them like regrets, you know, and things like that. But I feel that these regrets can change after you work for a few years, because like I said, the fulfillment that comes. So you have to do more patients, you have to see real life experience, then only you can find that fulfillment.
Purpose or understanding of why you are doing this, right?
Correct. Yeah. You don't just go in and know your purpose. You actually have to grow in this industry. Yeah, that's my point.
Wow. Okay. So what's next for you?
Like I said, there's not many options.
Yeah.
Yeah, but for me, I love educating people about oral hygiene, you know, especially kids as well, you know, parents. People don't know that it's the responsibility of their parents, you know, for the kids, oral hygiene. So I might specialize in dental public health in the future. And the other pathway is just down the road. Maybe I'll just go into private practice. as of now, I'm very grateful that I'm still a permanent dentist in the government, and yeah, I'm just doing the best I can, and we'll see how things go.
All right.
Yeah.
Thank you. Thank you so much for being here today, and we hope that you enjoyed today's episode of Education Talks. So if you like the conversation today, please like the video and subscribe to our channel, and also share this video with your friend. If you have any comments or feedback, we would like to hear from you as well. Drop us a message if you would like to know more about applying to a dentistry program or to find out more about the entry requirements to study dentistry and scholarship availability. Our educational consultants are more than happy to assist you with your inquiry. See you in the next episodes of Education Talks. Bye-bye. What are the 5 things you cannot go to work without?
I cannot go to work without. Practically everything is okay. Okay.
Have to pick 5.
So it's just normal life stuff, right?
I don't know.
Okay, number 1, coffee. I cannot go to work without coffee. Number 2, what else? Like my scrubs. Number 3, I can't. My wallet, my car. I need to drive to work, and my hairband. Yeah.
Okay. First thing you do every morning.
First thing I do every morning, I shower. No. Actually, the first thing I do every morning is tell myself, "Hey, I can go through today." I got the energy to go through today. Yeah, that's literally what I'm.
Energy to go through today.
Yeah.
Oh yeah.